A hip dip fat transfer gives you the natural results by shaping your body with your own fat. In this video, I'll explain how it works. To know more about this procedure, check out our article in the description below. What are hip dips? So hip dips, it usually refers to indentation or lack of volumes on the side of the hips area, whereas most people prefer a full round hip to go in line with an hourglass figure. When there is a hip dip or lack of volume in that area, it gives you the impression of an indentation or an inward direction of the curve. So hip dips are usually formed by the structure of the body, the genetics. Some people have fat pads in different position. Most common cause of hip dips is the lack of a fat pad or lack of volume in the hips area. Major weight fluctuations, weight loss can also affect the area. You can lose more volume, causing the so-called hip dips. What is the hip dip fat transfer? So the hip dip fat transfer means correction or filling the lack of volume or the dips in the hips area using your own fat transfer. So we start by doing liposuction, taking fat from areas of the body where we don't want the fat, and then filter it, prepare it, process it, and then injecting it into the hip area to give more fullness and roundness in an hourglass figure. So what are the benefits of hip dip fat transfer? The benefits of hip dip fat transfer is first the removal of the fat tissue from areas which unwanted, to give a better contouring of that area, such as the abdomen, the stomach, or the waist, and then using this fat tissue to augment and fill, giving the hip area to give more natural and a long-lasting results as compared to other techniques such as fillers, when the change can be modest and it can be temporarily. So the hip dip fat transfer is the most long-lasting and most effective way to achieve a natural and effective roundness and aesthetic contouring of the waist and hip area. What are the risks associated with hip dip fat transfer? So there are general and there are specific risks related to a hip dip fat transfer. General risks with any operation can include infection, bruising, pain, swelling, and the specific risks with the fat transfer to the hips are fat necrosis, fat cysts, and loss of the volume. However, most of these risks can be reduced following strict intraoperative and post-operative care. So it's important that you choose a surgeon who have the experience and the proper credentials to do these surgeries in properly licensed hospitals. What is the recovery process like? So the recovery process after hip dip fat transfer, it depends on how many areas of liposuction is included with the procedure. Usually it takes about a week to go back to light non-physical activities and about 2 to 3 weeks to go back to full physical activities. In that period of time, you expect bruising, swelling in the area, discomfort. You need to wear a compression garment for 6 weeks continuously, day and night, and it's important and crucial over the first 3 weeks from recovery to avoid any direct pressure on the hips area. So no sleeping on the sides, no lying on the sides with direct pressure on the hip area for the first 3 weeks, to allow the fat tissue to settle in place and to take. In terms of the pain, usually pain is moderate to mild, especially if you take the painkillers regularly. However, if you don't take the painkillers, then it can be severe. In terms of results, at the beginning, the first few weeks, because of the swelling, because of the bruising, you may not see the final outcome. It takes about 6 weeks for most of the swelling to settle down, and 3 to 6 months for the fat tissue to settle and the liposuction area to fully heal. So usually we get the final assessment at around the 6-month time.